as had been thought. Growing evidence shows that the virus is actually stripping red blood cells of its oxygen, giving the appearance of lung failure and forcing the lungs to work harder. So without oxygen, the body is effectively being starved of energy and dying. So what are your comments on this? Did you heard about this? Thank you very much.
Yeah, I believe it's likely that both processes are occurring. There's certainly no question that there's a direct impact on lung tissue from the virus itself, but there is this observation of rapid desaturation or rapid loss of oxygen in the blood, and we've seen many reports of this, and clearly there are multiple physiologic or pathological pathways in action here. It's not just the lungs are affected; many other organs are affected, and I think it's a dynamic issue. There's also the direct effect of the virus, and then there's the immune response to the virus. And in effect, we may be seeing in some cases a very robust immune response. Sometimes the immune system overreacting, and we've seen this in many other emerging diseases as well. So we may see a mixture of the immunomodulated responses. In other words, responses to the virus that are modulated by the immune system that may help kill the virus, but they may also do tissue damage. We see the direct effect of the virus itself, and then we see the effect on the oxygen carrying system, which begins in the lungs, continues in the red blood cells, and goes all the way to the tissues. And at this point, I believe clinicians around the world and pathophysiologists are really looking at what is the contribution of each of these potential pathways to the overall morbidity and overall mortality of this disease.
Thank you, Dr. Ryan. And now our colleague Katrien Fiancan. Can you hear us, Katrien, please?
Yes, I hear you. Do you hear me?
Yes, please go ahead.
Okay, thank you. Good evening to the three of you. First, before asking my question, I would like to have a clarification on a question that has been asked by a colleague before about that US media article that reported that there were US CDC experts working from the beginning on COVID-19 at the headquarters here in Geneva. So please, Dr. Tedros, could you elaborate a little bit on that and clarify this before I ask my question? Thank you, sir.
Sorry, was that the question?
Maybe you go with the other question so we just get it all together, please.
Okay, so the other question that I had is about vaccine, COVID-19 vaccine. A lot of scientists are working on it for the moment in the world, and in Switzerland there are scientists that are saying that they will be able to deliver a vaccine in about 6 months. That means for October, and eventually, if all the agreements, the official agreements are received, that vaccination could be started on Swiss population. I would like to have your opinion about inoculating a vaccine against a virus that is not already totally known by scientists. Is it dangerous or not? Thank you.
Thank you, Katrien. So we had one clarification and one question.
Yeah. The Director General may wish to speak on this. I can only speak in relation to the emergencies program, which is the program I run and the one that deals specifically with emergencies and epidemics. We've had, as I said, a very close working relationship with many institutions around the world. And again, by way of clarification, we've always had two permanent US secondees in the program. One who works specifically on influenza preparedness and response, and another who works very specifically in the area of epidemic readiness and emergency readiness at country level. For different events, including Ebola, we often have US CDC secondees here with us under the framework of the Global Outbreak Alert and Response Network. Right now, as I speak, we have World Food Programme colleagues, Clinton Health Access Initiative colleagues. We have UNICEF colleagues embedded here with us working on the supply chain network. We have colleagues embedded from other scientific institutions from around the world. But I would say that we always have benefited from a huge support, particularly from US federal institutions, but also from academic institutions and others. And in relation to this specific COVID response, have since the 1st of January had 15 details. In other words, 15 CDC staff who've been detailed specifically to work with us on COVID-19. And they've been exceptionally valuable and have worked across the spectrum, from risk communication to epidemiology to risk analysis to risk assessment and beyond. So that's a clarification on those numbers, but also to say that's in the framework of a much larger collaboration with institutions from around the world. And I hope that specifically answers the clarification regarding who's been here. Maria, you may wish to add.
Yeah, just to say that, working with colleagues from US CDC and from NIH and from academic partners is very usual for us. As an evidence-based organization, we work with all researchers all over the world, and so we have very close relationships with colleagues from CDC, with our very close partners. We work really closely with them before this began on MERS, for example. This is COVID-19 is a very closely related virus to MERS and to SARS, but we had an active, ongoing, almost daily communication with our close colleagues from CDC on MERS, which we were able to utilize very quickly for COVID-19 because of the similarities. And so it isn't unusual for us to do that. We have many US CDC colleagues on our global networks. So these are the networks of colleagues on clinical management, on infection prevention and control, on laboratory, on mathematical modeling and epidemiology that are working directly with us, and we really value this relationship. They've helped us to develop these zero-epi protocols that you've heard me speak about, and they're really great partners.
Yeah, and also just by way of a thank you to the American people, you see Maria sitting before you. On my core staff, I have 31 US citizens. Maria leads the overall health technical response. Janet Diaz from California leads the whole clinical response. Mark Perkins leads the whole laboratory response. And there are many other US citizens who are deeply committed to this work we do every day, and not just for Ebola, for hundreds of events every year. We all stand together with our colleagues in science, our colleagues in public health, in the Global Response Network, in the emergency medical teams networks around the world, in the collaborating centre networks. We stand as a thin blue line in trying to protect the world with in my programme, the resources that would not fund a single tertiary hospital in any major city in the world.
Yeah, thank you. I think it has been said, but the question came straight to me, so maybe they wanted me to say, because it was a question that was repeated. As Mike and Maria said, we have many experts supporting us, especially after this pandemic started, immediately after it started, from CDC. And WHO and CDC relationship is a very long-standing relationship. It didn't start with this pandemic. But not only that, CDC experts, as you know, CDC as an institution is a model for the whole world. And it's not without a reason, actually. Many countries call their CDC-type institutions Africa CDC, China CDC, so CDC, ex-CDC, Y CDC, and so on. Many countries actually with the same name, CDC. And it shows how CDC is very strong and influenced the whole world. And many countries want to have an institution like CDC. And CDC, because of its capacity, I think works with many countries, but at the same time with WHO. So that, of course, helps us, we work together, and helps us to do more. But at the same time, having CDC staff means there is nothing hidden from the US from day one. Because these are Americans who are working with us, and it just comes naturally, and they just tell what they're doing. And for WHO, it's open. We don't hide anything. It's open. Not only for CDC, them sending messages or others, we want all countries to get the same message immediately, because that helps countries to prepare well and to prepare quickly. So, to the question you asked, it's true. We have CDC personnel, but not only the US, all countries get information immediately. Of course, their presence doesn't give them more advantage than others, because we're open and we give information to everybody. Since our CDC colleagues also know that we give information immediately to anyone, they also can pass information to their institution. No problem. There is no secret in WHO, because keeping things confidential or secret is dangerous. It's a health issue. It should go immediately. And that's why everybody, whether they're inside with us to help, or ourselves or other experts from other countries, send out messages immediately. That's what we want. There is no secret in WHO, because it's about lives. And life is very precious. Even a single life is very precious. When we get information in WHO, we get information in numbers. This many people died, or this many people have been infected. We don't see the figures. We don't see the numbers. We see the individuals behind the numbers. We see the individuals behind the figures. Of course, we may have averages on this, on that, but we don't want to see the averages. We want to see the numbers. Anyone dying is a daughter or a son of somebody. Anyone dying is the father, mother, grandfather, grandmother of somebody. It's life. And that's why we prefer to see the individuals, the faces, the people. They're not numbers. They're not averages. They are people. They're individuals. And that's why we don't have secrets. And as soon as we get information, we pass it, because we want to save lives, even if it's one life. Even one life matters. One life. You can't bring it back once it's gone. And that's why we have been urging countries, please, this virus is dangerous. This virus is public enemy number one. This virus is new, and which has a behavior of serious contagion like flu. It's very contagious like flu. And at the same time, it's very killer like SARS and MERS. It has a very dangerous combination. And this is happening in 100 years for the first time again. Like the 1918 flu that killed up to 100 million people. But now we have technology. We can prevent that disaster. We can prevent that kind of crisis. We can prevent it. We're not in the same situation. We should not be afraid. We should have the confidence that we're in a different situation and fight it back. If there is national unity, and if there is global solidarity, if we take this as a common enemy for humanity and give our best, of course understanding that this is a new virus and dangerous virus, we can win the fight. We can. But please, let's consider those who are dying as individuals. They're not numbers or figures. Even one life is precious. You know where I come from. I know war. I know poverty. I know disease. I know how people suffer in war conditions. I know how people are killed because of poverty. I know how people who could have been saved are dying because of disease. I know a tragedy. I know. That's why I see people, I see faces. I see the mother or father of somebody. I see the daughters and sons of somebody. I see the tragedy that can behold a family. I see that. I see, and I know. I'm telling you from a first-hand experience. I know how losing a brother means from childhood. I can tell you all the tragedies I have seen. That's why in my last prayer I said, let's not play with fire. This is a tragedy which is already affecting many families. Many are losing their loved ones. So we don't hide information, because I know what poverty means. I know what war means. I know what killer disease means. I know what is behind all these problems. And I have been warning, we have been warning from day one. This is a devil that everybody should fight. Then the solution we're proposing, we need national unity. Strong national unity. Everybody fighting this virus. Taking care of their citizens. Taking care of real people. We need global solidarity. That's cemented on genuine national unity. Without the two, without national unity and global solidarity, trust us, the worst is yet ahead of us. Let's prevent this tragedy. It's a virus that many people still don't understand. Many countries are very developed, putting the wrong conclusions because they didn't know it and got into trouble. And we warned even developed countries saying this virus will even surprise developed countries. It did. We said that. It will surprise even wealthy nations. We said it, it's on record. Let's stop additional surprises. Let's stop tragedy. Hundreds of thousands now dying is serious. Even one life is precious. Let's say enough is enough.
Thank you. There was a question on vaccines. Maybe Maria can help.
Thank you, Tarek. The question was about the development of a vaccine and the claim about rapidly producing one in perhaps 6 months. So we welcome all work on the development of a vaccine and as rapidly and as safely as possible. We welcome this. The question was about whether or not you can develop a vaccine on a virus we don't yet know, if I understood the question appropriately. There are more than 10,000 full genome sequences that have been made publicly available from all over the world. And there are a large number of scientists and virologists who are looking in detail at each full genome sequence that is available. And we thank all countries, everyone who has made those sequences available, because that allows us to check these viruses and see if the virus is changing. And what we see among these 10,000 viruses is that it is relatively stable. There are little changes, normal changes in viruses, but nothing that's unexpected. And so the development of a vaccine on viruses that are available is good. And so there are many vaccine candidates that are in development, and we're working with many partners to accelerate this. And so as quickly as possible, quickly and safely as possible, we welcome this, and we welcome not only the development, but the equitable distribution of any vaccine that does become available, because we will need a vaccine in the future.
Thank you very much. We have time for 1 or 2 more questions. So let's try to go to Duyang from Xinhua. Can you hear us?
Yeah. Can you hear me?
Yes, please, go ahead.
晚上好，我是新华社记者杜阳。在联合国中文日，很高兴能在联合国中文日用中文向世卫。在刚才的答辩者问，谭德赛总干事特别强调了数字后的每一个家庭。我的问题是，在这次抗击疫情的过程当中，有没有哪些人或者哪些事让谭德赛总干事觉得特别感动的？谢谢。Thank you.
Thank you. The question was for Dr. Tedros, if he would have any stories.
No, I was saying when, you know, okay, 100,000 people died or 200,000 people died. What I was saying was, let's not focus on the numbers. When you say 100,000, for many people, it could be just figures, numbers, and it may not mean anything. But what I am saying is, let's believe that behind those 100,000, there are 100,000 people, faces, the mother of somebody, the father of somebody, the daughter of somebody, and the son of somebody, or the grandfather of someone. These are real people. Let's not trash them into numbers. And the reason I feel this way is, I said it earlier, I know war. I know how people suffer. And from that war, when a loved one loses its life and how the family feels, I know poverty. And I know people who died of poverty, and I know how their family or loved ones feel about that. I know disease that could be prevented that killed people. And I know how the family feels. When we think about death or disease, I was saying let's bring into account that these are real people. And that's what we're losing, real people who could be saved, but who might be dying because of our own weaknesses of our society. And I mentioned one or two. And I said it many times, I will repeat again. this virus is dangerous. It exploits cracks between us. When we have differences, there are cracks. The virus exploits those cracks. Take as an example ideology, or in one country, it could be the differences along party lines. It exploits that. That's why I said we need national unity. And whoever has whatever ideology, whether that person is from left or right or center, they should work together to fight this virus, to save these real people. If we don't do that, this virus will stay longer with us to kill more people, and we will lose more precious lives. So when I think about the losses of life, it reminds me of my own experience. These are real people dying, and I'm just warning people who may think that these are numbers. They're not numbers. These are people. And the other point is, when there is national unity, the global solidarity could also work. I have spoken to many leaders from many countries, from the incumbent or the opposition, and one message to all of them: please work together. Don't use this virus as an opportunity to fight against each other or score political punches. It's dangerous. It's like playing with fire. Please work together. We need national unity. We're seeing the tragedy. And we need global solidarity that's based on honest and genuine national unity. I will say it again and again because it's true. It's the political problem that may fuel further this pandemic. People say this is political, and Tedros, you're a technical organization, don't say it. But if it's fueling the pandemic, and that's the very reason, why wouldn't I say it? At the end of the day, we should know the root cause of the problem and try to address that. It's fueling it. The cracks between people, between parties, is fueling it, and it's true. And that's the reason. And you said, being emotional, what made me emotional? Because I know death, I know war, I know poverty. I know how people really are influenced by all this. Maybe for people who don't know this, maybe they're lucky, they may not understand it. Maybe they had an easy ride in life, so they don't understand what this means. Maybe they don't understand what poverty means. Maybe they don't understand what war means. That's why I'm being emotional. I know the tragedy that comes from disease, from pandemics, from war, from hate. You call it from poverty. And I resist to keep quiet and not say what I see is wrong. That's why. So that's why I'm saying I'm bringing my own experience. It's not because others don't know it, but it's very important to remind each other.
Thank you very much. Maria, you want to add something?
No, I think that the question about, what has moved us, I think the DG has said very eloquently, what moves us, speaking from his heart. I think from my side, one of the things that's moved me the most are the videos of the healthcare workers who have not been able to see their children or not be able to hug their children. And there's so many videos of this online now. And there was one in particular of a man coming home from work, and his son ran up to him and he put his hands up, and it just got me. But we just, we thank our frontline workers, not just health workers, but everybody who's on the front line who are putting themselves out there. And just very grateful. But those are the types of stories that I think get me the most.
Thank you very much. So maybe we will take one more question before closing down. Let's go to TAS agency. That's Ina. Ina, can you hear us?
Добрый день. Я вас слышу.
Yes, please.
Алло.
Please go ahead.
Алло.
Ина.
Добрый день.
Добрый день.
Очень приятно. Спасибо за возможность говорить по-русски. Я хотела спросить не про то, что мы прямо сейчас делаем в отношении коронавирусной инфекции, все страны мира и России, естественно, в частности. Мой вопрос касается того, что страны находятся сейчас в более или менее похожей ситуации, когда все силы здравоохранения направлены на борьбу с коронавирусной инфекцией. При этом мы понимаем, что неинфекционные заболевания никуда не ушли. Рак не ушел на карантин, сердечно-сосудистые заболевания остаются. И даже вот эти 2 месяца самоизоляции нам дадут в будущем проблемы у людей со здоровьем. Что планирует ВОЗ в этом отношении рекомендовать, когда мы начнем выходить из этой самоизоляции? Спасибо.
May I just for others who are watching us on other platforms to repeat what was the question? The question from Ina is about non-communicable diseases. We know about COVID, what's going on, but what about lockdown, people who stay home for months now, how that could have a repercussion on some other conditions they may have?
There is no doubt that certainly the lockdowns have had a major impact on social, economic, and also on the delivery of other health services. Health services themselves and health systems and whole hospitals have become overwhelmed. The disease was not contained or suppressed initially in a way in which the hospitals could be protected. So in that sense, people lost access to the hospitals because they very often became overwhelmed by COVID cases, or elective surgery was cancelled as a means of creating hospital beds, which is perfectly appropriate. But elective surgery does not mean unnecessary surgery, for example. That's elective in that it can be carried out in a planned way. It is still necessary surgery. Cancer chemotherapy, others, immunization programs in many countries are an absolutely vital defense against other infectious diseases. So there is no doubt that other health services have come under pressure in all systems. And we've had a group working very, very hard on sustaining continuity of other health services during this time, so that basic, essential health services under the Rubicon of universal health could be and can be still be provided. And therefore, no one would like to see the public health and social measures, those broad-based measures which many people refer to as lockdowns. Everybody wants to be able to see those lockdowns transitioned away from. It's very important. The difficulty is that those measures were put in place to suppress what was an intensely burning epidemic. They were an emergency measure put in place by governments who had seen an exponential rise in cases, and in many cases, unlike in the cases of some of the Southeast Asian countries, the initial attempts to do containment failed, and the disease spread and accelerated. And in that situation, there was very little option for countries but to impose this type of lockdown. The difficulty is unlocking or transitioning away from those measures means there is always the chance that the disease may rebound. And we've been saying quite clearly, in order to move away, and we need to move away from these lockdowns, but we need to not move away from lockdown. We need to move towards something else. Moving away from a bad thing or something that was necessary and that has done has caused so much hardship for people is a good thing. But if you don't move towards something else, you may be back exactly where you started before you know it. And we need to move towards empowered people and communities who understand how to protect themselves and how to protect others, and who are willing to continue with the degree of personal hygiene and physical distancing that will be necessary going forward. We need to move towards stronger public health capacities, not just testing. Testing is a hugely important central piece of surveillance, but we need to train hundreds, thousands of contact tracers. We need to be able to find cases. We need to be able to isolate cases who are confirmed. We need to be able to quarantine contacts. We need a system. We need an absolutely massive increase, the same massive increase we saw in the health systems, in healthcare, in ICUs, in ventilators. That's all we seem to talk about is ventilators. They're very important. Absolutely very important. But we need to start talking about contact tracers. We need to start talking about quarantine facilities for contacts. We need to start talking about community-based surveillance. We need to invest in the alternative to lockdown. And we need to strengthen the healthcare system at the same time, so the same tragedy of overwhelmed health systems does not emerge again should the disease rebound. We have said this since the beginning of this epidemic, pandemic. We have said this since the beginning. So we will work with countries and support them to put in place those systems. And we see many countries moving very carefully and in a very united way towards those objectives. And we will continue to support those objectives. But in the and if we do that, then our hospital beds are freed up, our clinics are freed up, people can go back to see the doctor, and our essential health services can come back online. Because nothing is more important than that right now.
To add to what Mike has said, we have issued some guidance about maintaining essential health services, because this is absolutely critical that other services continue. Babies are still being born, and children need vaccinations, people need vaccinations. This needs to continue, and it needs to be done in a safe way. So we do have guidance that has been put out to try to support countries in trying to maintain that. We've also seen some innovative ways in which countries have been able to use telemedicine, for example, so that there are still a continuous way in which doctors can speak with their patients, and so that they can maintain that care. And it will be temporary, as we've said, that once the measures are able to be lifted, once these public health and social measures are able to be lifted, these services can get back online. We've seen countries be very strategic in the way that they care for patients. Perhaps in some areas that are overwhelmed with large numbers of patients, they're either not cared for in that specific locale, they're moved to other parts of the country. We've seen some countries who are having low incidence accept patients from countries who are having explosive outbreaks, and that solidarity and that support and that generosity, is really welcomed, and we're very grateful for that, and I'm sure all the countries are grateful for that. But it is important that essential health services continue. We have large groups within WHO and our partners in ministries of health and across different sectors who are trying to continue all of those services. And we will continue to support countries in doing so throughout this pandemic.
Okay, and we will take one more question. And from Portugal, Ines from Porto Canal, first time with us. Ines, can you hear us?
Yeah. Can you hear me?
Yes, please go ahead.
Okay. I would like to know how WHO is seeing the development of this pandemic in Portugal. From your eyes, is Portugal on the controlled stage, let's say this way, of COVID-19? And also, if you allow me, I will ask you one more question. I would like also your thoughts about numbers in Portugal. Despite being seen as a success case from many countries, Portugal has one of the worst numbers per million of inhabitants in positive cases and also in mortality rates. So I would like to get your thoughts also in this matter. How do you see it? And are we far yet from this pandemic control? Thank you.
I think Portugal has had, yes, I mean, I think there's been, again, I don't have all of the numbers to hand, but there's been about 680, 690 deaths in Portugal out of a total, I believe, of around nearly 20,000 cases. And this impact on the face of it has been lower than in Spain or France, but you're correct, the population of Portugal is much lower. And when you do that out across population levels, then that impact, there's been quite an impact. The rate of the epidemic is growing around a quarter a week, so the doubling time for the epidemic in Portugal is about 4 weeks, which is actually reasonably good. Now, nobody wants to see that number of cases per day, but it does mean that Portugal is in a steady state. I'm not. You can tell me to what extent you believe the health system has managed to cope. I believe it has coped reasonably. It has coped reasonably well, but certainly the testing is there. The hospital system is doing its job. But the impact, given the small size of population in Portugal, has been heavy as well, even if the numbers, the absolute numbers don't tell that. But I suppose the good news in this is that certainly the rate of a disease is stabilising in Portugal and declining, and we hope it continues to do that. Maria?
Not a comment on Portugal, but just a comment on many countries that are now seeing a decline in cases. This is wonderful. This is very welcomed, and you've worked very hard to get to that point. I think we all need to make sure that we are very careful in terms of our measuring of success here, because we need to learn from all countries that are at very different stages of this pandemic, very different stages of the outbreak. And we're seeing some countries in Asia that are now starting to see an increase in cases again. And I think that this is because there are systems in place to find cases. No country should be punished for finding cases. This is a part of the success of dealing with this and finding those cases, isolating cases, caring for cases, finding all contacts, quarantining those contacts, and keeping your public engaged, making sure that everyone understands that this is going to take some time. And in many countries that are starting to see declines, if the lockdown is lifted too quickly, if the lockdown is done all at once, you could see a resurgence in cases. You could see that this virus can take hold in certain closed settings, and it can take off again. So I think it's important that we understand that even though we are seeing successes, we should take some pride in that, absolutely. But we still need to be on guard. And we absolutely must remain vigilant, because what we're learning from these serologic studies, these early serologic studies, even with all of their faults and all of the limitations, a lower proportion of people are actually, it appears, are infected. And that means a large proportion of the public remains susceptible. And so that means that the virus can take off again. And so we need to ensure that the measures that are put in place are done carefully, but also that when they are taken away, they are also done in a slow and staggered and in a controlled way, and that the systems are in place, the workforce is there, the people are there to detect these cases, find the virus, find contacts, and we have locations where they can be cared for safely.
Thank you very much. We will take one more question, and that's from Helen Branswell. Helen, can you hear us?
Oh, thank you very much for taking my question. I know vaccine isn't going to be ready yet, but at a point it will be. and there's going to be a lot of competition for early supply. Is WHO working with countries to try to come up with a fair allocation system to try to ensure that what is available is distributed broadly and fairly?
Thanks, Helen. Yes, WHO, as always, works on these issues, and as you know, we work on a large number of global vaccine allocation mechanisms within the international coordinating groups for meningitis vaccine, for yellow fever vaccine, for cholera vaccine. We also have similar mechanisms for diphtheria antitoxin. We've worked for over 20 years in trying to ensure that that products like vaccines are distributed in emergencies on the basis of epidemiologic need and on the basis that they will do the most good in combating the disease and preventing spread. And we intend to do exactly the same here. This vaccine development is hugely welcome. The development and upstream development of products is very, very important. But what's also important is scaling up and ramping up production of those vaccines so that they can be allocated fairly across the world and do the best possible good. Even if we do have enough vaccine, and even if that vaccine is allocated, we've got to have the systems to deliver that vaccine, which will probably be well beyond. We're very good at delivering vaccines in children. As a global health architecture, we're not very good at delivering vaccines in other than children and adults. Secondly, we have to be sure that communities are fully on board. We've seen a lot of problems with vaccine acceptance. So when we look right along the value chain of vaccine development, we're very focused on the product development, and that's very important. But there are whole ranges of things that need to be done downstream to make the use, the scale-up, allocation and use of any product successful in public health terms. And all along the way, we have to keep safety and efficacy in mind. There are many initiatives emerging around the world. I've heard of initiatives in the UK, in the US, in Italy. It's really, really important at this point that there is cohesion, coordination, collaboration at the global level. There are 193 or 4 or more countries and populations and peoples that share this planet. They all deserve to have access to the benefits of a vaccine, and we must ensure that all nations benefit from the development of such a vaccine, and it is WHO's intention to create the convening and forum mechanisms and forums to ensure that happens as quickly as possible. And I'm sure the Director General may wish to speak to how he is working with Bill Gates, with other governments, with other leaders around the world to pull together the necessary coalitions and the necessary coordination and the necessary coherence in order that everybody, in doing their job, everybody has a job. Whether you're a researcher in a lab, whether you're a person in a manufacturing company, whether you're a person doing technology transfer, whether you're a person deep in the bush doing community awareness and engagement, preparing people for this vaccine. This is probably one of the greatest, if this is to work, it will require one of the greatest scientific, one of the greatest political, one of the greatest financial, one of the greatest public health operations that we've seen in a generation. That must be done with proper leadership and stewardship. And I hope that and trust that we can do that together.
Yeah, thank you. Thank you, Helen. So we're working on two things. One, to accelerate development of a vaccine. And second is access and equitable distribution. And we're already discussing with many partners, relevant partners, and look forward to announce the initiative as soon as possible in the next few days. Thank you.
Just one clarification Dr. Ryan would like to make before we conclude.
No, I just want to make one clarification regarding remarks I made on Friday in response to a question from a Chilean colleague regarding diagnostics in Chile. I think our colleague asked about testing and discharge testing. I misinterpreted that, and I spoke about antibody testing in general. And my comments on antibody testing are on the record, and I'm very, very happy with those comments. But I did want to clarify that I wasn't speaking in reference to the discharge criteria that are currently being used in Chile in accordance with the WHO guidance, because my comments may have caused some confusion in Chile, and for that I apologise. And just to say that Chile has had a multi-sectoral response since the beginning of this epidemic, has had an advisory committee to the Minister of Health from science and society since the very beginning, has actually had in place before this outbreak an emergency stockpile, and has a history in the Americas of having one of the strongest public health systems, with a strong testing strategy and a crude case fatality of 1% or less. So I'd like to congratulate the government and people of Chile for their excellent actions, and apologise if my comments caused any confusion. Thank you.
Thank you very much, Dr. Ryan. We would thank everyone who was watching us today. This was our first time to have a simultaneous interpretation. I think we are all happy that we had journalists asking questions in different languages. We were all only missing Spanish. We hope that will come next time. And we will send the audio file in English. We are looking now how to do for other languages. This is really just the beginning, so hope things will go in the right direction, and we will try to have even more journalists and promote this press briefing all around the world. Thank you very much, and have a nice evening.
Yeah, thank you. Thank you, Tariq. And once again, we salute our health workers. This is a day when we remember Dr. Richard Muzoko, who gave his life while saving others, fighting not only Ebola, but fighting bullets. Imagine working to save lives in the middle of a war. That's actually the face of WHO. And now, in the middle of this crisis, many more health workers are losing their lives to save others. And we salute you. All the respect and appreciation from us. And to our journalists and others who are following our program, I would like to say thank you so much for joining, and see you again on Wednesday. All the best.